We were having a lot of opioid-related deaths on the nation, and we were really concerned about people being able to access care. And we started looking at different models across the province and how we can enhance our existing services here on the nation. And one of those was the mobile integrated health program in Calgary and the city centre team, which also helped address people who didn't have really good traditional means into clinics and primary care. So I think that the community paramedic program, some of the services as we get going, not just around COVID response and the supporting people with addictions and mental health issues, but the spectrum of their role is so vast. Supporting with in-home IV antibiotics and wound care and connecting people to those other resources as with in the community and then off reserve is really helpful. They've made significant relationships with people in the community already, particularly those that are vulnerable, that live in our shelter and stay sometimes outdoors, that don't have means to sometimes get their medication. Those daily follow-ups, I think, are really advantageous to making sure that people stay on their medication and to be well.
So when community members have emergencies and acute healthcare needs, so heart attacks, car accidents, overdoses, and strokes, they need to call the ambulance. For when they have less emergent things and chronic conditions and management of that, that's when the community paramedics can come out and help. You see, all of our community paramedics are advanced care paramedics. We all have experience working on the ambulance, but what we have in addition to that is some training in primary and kind of chronic care management.
Community paramedics, we don't work on an ambulance, so we don't typically transport our patients ever. We're providing their care in their homes and encouraging the strengths that we have in the community so that they can stay home.
So we see complex and vulnerable patients. So again, those that have multiple diagnoses that are typically quite ill and need health services beyond what family clinics can typically provide. And often they seek care that is not acute care, but they seek it in acute care resources. And vulnerable patients that again have trouble accessing the standard Monday through Friday 9 to 5 health services. So we enhance the typical health services that the rest of us benefit from, and we enhance their reach and their capacity, and we bring those health services to those patients that really need it the most.
We work with a lot of different healthcare teams here on Siksika. We work with mental health and addictions counselors. We work with crisis counseling, home care. We work with the RCMP and physicians and nurse practitioners directly.
Our role in the community is mostly to eliminate the barriers that traditionally in the past have prevented people from seeking the care that they need. And then another way that we support is just igniting that hope that they can do it and we can empower people at home.
I feel really privileged to work out here. It was a great opportunity. I've been a community paramedic since the role was first brought to Alberta about 10 years ago. And I was lucky enough to help the original program in Calgary grow into something that's now across the province. And when it first came to my attention that they were looking to apply it to an Indigenous reserve, it just seemed like a great opportunity, that there was a lot of strengths that would enhance the role. And there was a lot of things given, kind of the traditional barriers to care that often nation members face that we could help overcome, while at the same time really leveraging the strengths of the community.
I know a lot of our nation members, and the staff that are with us now have started to get to know the community. They're starting to get to know the culture. They're starting to know cultural and spiritual ways of, by asking questions and just educating to help better on calls. It's more personal down here. It's a lot more looking forward to coming to work, because we're dealing with our Nation members and we're helping them the best that we can. And all my coworkers, we're all on the same page. They love coming to work also.